The Connecticut shooter's brother has reportedly told police that his brother had autism or Asperger's syndrome, as well as a personality disorder. Joining me is Carolyn Wolf, an attorney who specializes in mental health issues. Carolyn, in your experience, when a person has certain behaviors, like we've seen in the shooter, are any of these disorders the type that would exhibit themselves in this manner?
Not in the manner to which we've seen in the last several days, but certainly there are signs and symptoms that lead up to certain behaviors. So if you know what to look for, the red flags as I call them, if you know how to identify them, you can actually go back and see what could be potentially problematic.
But to put parents at ease who may have a child who has either autism or Asperger's, just the presence of some form of autism or even Asperger's shouldn't make them say, oh, my child is potentially a mass murderer just because of the disorder.
No, you have to put it into context. It's really the behaviors that you want to look at, and it's the change in behaviors that are really are of what's concerned. You have a child who is doing well in school, is socially active, is behaving appropriately, and then suddenly there's a change. They become more isolative. They become more socially unengageable. They don't want to go to school. Their grades go down. Those should be signs to parents to at least take a look at and put into context the behavior and any symptoms or any diagnoses that may be at play.
And the reason I want to kind of delve into this a little bit, because I think some parents say, whew, I don't have to worry about my child because he doesn't have Asperger's or any form of autism. And that's not necessarily a valid conclusion either, is it?
No, it's not. First of all, autism is a spectrum disorder. So there are many different behaviors and symptoms along the way. In addition, there are other disorders that are at play. There are serious mental health issues, there are personality disorders, there are characterological disorders. So you really need to focus in on what it is you're talking about. We try very hard to ascertain a diagnosis, or at least a working diagnosis, and then go from there and sort out what are our expectations. What can we expect to get worse? What can we expect to be treated? What interventions can we bring to bear? And we work as a team approach so that we can bring in mental health professionals, case managers, for example, psychologists, psychiatrists, who can address each individual symptom based on what's going on psychologically and psychiatrically.
And Carolyn, I want you to help our audience understand, because they've heard a lot of words thrown at them over the weekend, words that you use every day in the course of your practice of law and psychology, but most people don't use these words and maybe they're not familiar to them. When we say that a person is a psychotic, has psychotic behavioral tendencies, what does that mean?
That usually means a break with reality. You're not able to see things realistically. You're not able to process information coming in a realistic way.
And a sociopath, what does it mean if a person is described as sociopathic?
Sociopaths is a characterological disorder, and it manifests by usually people who can't feel. They don't have empathy. They don't connect to the usual day-to-day feelings that most of us can connect to.
So some people could be somewhat psychotic and sociopathic. Is it possible to be a person with both characteristics?
From the mental health experts I work with every day, I believe the answer to that would be yes.
Okay, so that's what I think I want to make sure that people understand. This is very complex. It's not like you can just take a child and say, oh, he's got Asperger's, therefore he is more likely to do a mass murder. Oh, and by the way, that means he's psychotic. It really does involve a very complex kind of diagnosis.
A complex diagnosis, as well as putting it into context and really looking at how it manifests in the real world, how people interact with other people, how appropriate the treatment might be, whether people are open to treatment. Interventions, getting help. Denial, I think, is the biggest problem that we face in my practice. Parents, it's difficult for them to say, my child is having mental health issues. If they can get past that hurdle, then they're more open to allowing experts in the field to intervene and try and head off any problems down the road.
And Carolyn, the stigma, it's very difficult. And I feel for parents who, as you say, are very afraid to say, oh, I think my child may have a mental illness, because then you have a child saying, there's something really wrong with me that's different. But we need to help people to understand that a mental illness is no different than is a physical infirmity. We don't say, oh, a person has a broken leg, I can't talk about that. That would be embarrassing, that somebody might think that my child has a broken leg or appendicitis. How do we get to the place where we can treat mental illness as it were comparable to any physical ailment we have?
It's funny, that's something I say in my practice to my clients every day, and I think it goes to the conversation. It's the conversation people need to have with one another. It's the conversation they need to have with their physicians, with other mental health professionals with whom they work, with the mental health attorneys. They need to have that conversation and say exactly that. It's a brain chemistry issue, it's an illness. If you had a heart problem, you'd go to cardiologist. Just what you're saying, if you break your leg, you put a cast on it. But it's been so many decades of people having that stigma and thinking it's bad. And also the publicity that goes with it. Every time there is a tragedy such as the one we've seen this week, the first questions asked are, does he have a mental illness? Rather than what went on with this individual or what might have led up to it or what issues was he facing. So I think we need to have that conversation to destigmatize this as much as we can.
I couldn't agree more. I think it's such a very important thing that has to happen, hopefully, at some point in our culture. There has been a common denominator, seemingly, in a lot of these mass shootings involving young people or even children. And the common denominator is the prolific manner in which many of these kids played very violent video games. I'm going to be careful not to just immediately draw the line from the video games to the behavior, but there does seem to be some connection. Do you see a connection? And if so, how do we deal with this?
Again, I think you have to put all of this into context. If you're seeing other behaviors and they're playing video games, there's probably a bigger issue than the video game. There is a lot of talk, a lot of research being done on whether video games actually lead to violence. I think it's very hard to connect up the two. When we take a history, there's a lot more going on in the course of the discussion than just my son or daughter spends all day playing video games. I think you need to have a predisposition for the video games to actually cause you to then take some sort of negative action or become violent.
I want to continue that thought and discussion when we return. We will be right back with Carolyn Wolf when we return on this special edition of Huckabee.
To pray that God's going to help heal these people who've lost children. We have two daughters, and I just can't imagine what it must feel like.
We are back with Carolyn Wolf, and Carolyn, we were talking earlier about the video games and the influence that they have. And I think you made an important point. Just because a kid plays a video game, even a violent one, does not mean he's going to turn into a mass murderer. But if there is a child who's already got certain things going on in his head, the detachment from reality, the inability, it could be a trigger point to take him off to where most kids wouldn't go.
And that's the context that you have to put this into. That's people, parents, teachers, friends. You know, we have an issue with friends not wanting to rat their friends out or tattle on them. Friends of many of these individuals could actually be very helpful in at least bringing to an adult's attention that there's an issue. Who do they play their video games with a lot of the time? Their friends. So I think, again, it needs to be looked at in the bigger picture and what else is going on in that bigger picture in addition to just watching the video games. But as you said, yes, it could certainly act as a trigger.
It's so easy to look back and see certain signs, and people are now saying this mother surely must have seen behavioral tendencies in her son. She pulled him out of school, had homeschooled him. Reports are that she had a collection of guns, taught him how to use them. Talk about some red flags that you could identify in this situation based on what we do know, realizing that it's an incomplete picture at this point.
Well, we found that we actually can train parents, schools, college personnel, faculty, teachers to identify behaviors. They don't have to become experts in the mental health area, but they can certainly identify behaviors that start to move away from the normal behavior. They have a kid who sits in the front of the room all the time and participates, suddenly is sitting in the back and is very quiet and is writing strange things or saying weird things. And parents can do the same thing. They can notice that their children are normally happy and active and social, and now are suddenly isolating, spending more time in their room, having trouble in school. And it's really important to take some sort of action rather than just pulling them further into the isolation, homeschooling them, for example. And I'm not saying that may not be appropriate in some cases, but it's isolating. Parents should go to the school, talk to the guidance counselors, talk to the teachers, ask what's going on. I'm seeing a change at home.
And there are also behaviors, I mean, for example, that can be triggered by family situations. In this case, you had a mother and father who divorced a few years ago, so that changes the social structure. I'm not saying that you blame the parents, because sometimes it just doesn't work out. But if the child starts manifesting significantly different behaviors because of either a divorce, a death in the family, a loss of a pet, there could be many things that could help also trigger some of these behaviors.
That's why we work very closely with parents to talk about exactly that. What's going on in the home? What's changed? What's changed led to different behaviors in children? And then bringing in a team of mental health professionals who can then address those changes. Because they are, again, easy to identify in a lot of cases. You just have to know what to look for.
Carolyn, I think people are afraid sometimes to raise the flag. They're very reluctant, not just on a family member, but school counselors and others, because they're afraid either of liabilities, or they're even afraid that they're going to be seen as sticking their nose in someone else's business. Where's that line of propriety?
I think as we see more and more of these incidents and tragedies, the dialogue is just starting to be more towards, we need to look at this, we need to talk about it, and we need to set up systems to address it. After the Aurora shooting, we heard about the behavioral intervention teams on college campuses. Those are multidisciplinary teams that are set up specifically to identify kids at risk or kids who are reported to have at-risk behavior or red flag behavior. And then not just to target them, so to speak, or to spy on them, but to actually come up with an intervention and a response that's multidisciplinary that can address the concerns that are being brought to the forefront. And I believe, unfortunately, now schools have to start to do that in the lower schools. It's unimaginable that you would do that in an elementary school, but maybe we need to start to look at that and to do that.
Carolyn, thank you very much. Very helpful and very, very practical. Nice to have you here.
Thank you very much.
And I do hope that people will use this as an opportunity to realize that if there is some evidence of a mental illness, whether it's in your child or in yourself, that you don't feel like somehow that it ought to be embarrassing to get help. We ought to come to the place in our culture where it's embarrassing to not get the help.